And the second one we say is preeclampsia. The preeclampsia means that person, in addition to the hypertension was detected after 20 weeks of pregnancy. 20 weeks after 20, that is after the second half. Aside having the high blood pressure, the person to maybe they did a test. Usually for simple, we usually test for their urine to see if they have what we call protein in the urine.
Why proteins are not supposed to be in the urine?
Ideally, no.
No.
No. The kind of protein we check for, they are not supposed to be in the urine. Yes. It means if we are finding such a protein in the urine, it means there is a problem. There is a problem. So if you have hypertension and then you have some symptoms and signs which we'll go through later, in addition to the protein in your urine, then it means you have what we call preeclampsia. That is, it is the BP, the high blood pressure was detected after
20 weeks.
Yes.
After 20 weeks.
After 20 weeks. Meaning your BP had been normal all this period, but after 20 weeks,
we saw that it is
going high, and then you have protein
in your urine.
Then it means you have preeclampsia. Then if, like I said, preeclampsia/eclampsia, if the person should have some convulsions.
When you say convulsions, what do you mean?
The Anglos, Gili, is that not it?
Like the person
will be shaking vigorous or have a fit. A fit. Very aggressive. If the person should experience that, in addition to having the high blood pressure and then the protein in the urine, that is eclampsia. That is how to simply say that. Eclampsia. So that is the second part of the second
one.
Yes, or a complication of the second classification. So the other one is the chronic hypertension with superimposed preeclampsia. It means the person already had the high blood pressure before 20 weeks. But
after the 20 weeks,
as we go along, the person also tested
for proteins.
Positive for protein in the urine. So we say, or had signs and symptoms suggesting that the person may be having preeclampsia in addition to the proteinuria. So that's when we say.
Let me see whether I understand you. So if for the third point, the person has chronic hypertension, then after 20 weeks, you notice some signs. Maybe the person is fitting.
Once you fit, then it makes it
eclampsia. Yes. So he has some signs symptoms,
which we say we'll discuss
later. Then you classify it as a third one.
Yes. I mean, it could be mixed up, but we just break it down
to simplify it.
Yes, to simplify it. Then the fourth one is the gestational hypertension. So it means, or pregnancy-induced hypertension, which is the old name. It means this person only had a high blood pressure without the signs and symptoms of the preeclampsia. Meaning the person didn't have the signs and symptoms, as well as no proteinuria. But such people are at risk of developing preeclampsia later if they are not closely monitored. This is the key difference. So the fourth one, it means your hypertension was detected after 20 weeks. Yes.
But without
proteinuria and without those signs and symptoms.
So with all these four, which of them is would you say is a danger point for us to be careful of, or all of them are equally?
Hypertension
in general,
it's something you have to keep an eye on. So when someone has hypertension in pregnancy, your focus is to make sure that the person gets the best of care in order not to develop the complication. Or should the complications start,
it will not be so bad.
You'll be able to help save mother and baby immediately. If you are not, if worse come to worse and you can't save the baby, at least you should be able to save the mother.
Wow, this is getting interesting. We have a discussion with Dr. Prosper Bochi, a senior medical officer of the Hohoe Municipal Hospital. So, Doc, at this point, why should we even be concerned about this disease? Why should we be concerned about it?
So, I mean, like we are saying, pregnancy is not supposed to be a disease. I mean, if you are pregnant, the whole world is happy for you. But our major concern is because of if you have a high blood pressure and measures are not put in place to control it and help you have a safe pregnancy and delivery period, the complications are frightening.
Wow.
They are frightening. This is the key reason, and it's one of the major causes of maternal mortality.
Wow. Wow.
One of the major
causes.
Yeah. I think it's second after
bleeding.
Yes, hemorrhage.
Wow.
So if you are not able, because of the complications are there, sometimes you may not die, but the sequelae of the BP not being controlled can be devastating. Because one thing with high blood pressure, if not controlled, can damage almost every part of you, from your brain, your eyes,
everywhere,
your heart, your liver, your kidneys.
What are some of the worst you have experienced with this condition?
Okay. Then I was just in 37. The very first time we had a case brought from a private hospital. This woman was obese, had just had a cesarean section because they said her BP was very high, and she was looking very jaundiced.
Wow.
She was not making much urine. Very, very jaundiced, and this is someone, when they say the person is obese, is actually obese.
Very obese.
And was not making much urine.
How old is this person?
She was in her early 30s.
Early 30s, wow.
So she had developed a condition we call HELP syndrome. It's one of the complications, which we'll talk about later. And it was so bad that the person has to be admitted at the intensive care unit.
Wow.
And then to seek were passed through the neck to get into the heart before blood is taken to do a sample, and then we do exchange, do blood transfusion, a lot of blood transfusion, and a lot of tests every night. Then we have to be checking whether her liver function is good. And then another one that I witnessed in here. That was last year. One of the cause of her
maternal death.
Yes, wow. This is someone who had twin pregnancy.
Twin pregnancy.
Yes. Okay. And then she fitted at home because her blood pressure went high. And you see, when she fitted at home, because there was nobody with her expert skill to handle her, she vomited and aspirated the vomiters.
Wow.
And here, you see, once you vomit and you aspirate, it blocks
your airway.
Yes. Chances are that
you can easily die.
Yes. Even if we are able to pass a tube into your airway and put you on a ventilator,
the infection alone,
chances are very minimal.
Wow.
You understand?
Wow.
Yes. So we lost this woman. We lost the two babies.
Wow.
Yes. That's how sad it was. So these are the worst. The past 2 weeks, we had 2 cases of eclampsia.
Just these 2 weeks?
Yes.
Wow.
No, not 2 weeks. Just last week.
Last week?
Yes. After the celebration, the next day, we had eclampsia.
It was like a welcome address for you people.
It was a young lady. She was brought from one of the sub-districts. Fitting. She was sent to the health center. Immediately they saw the condition.
They said you have to send it to a major.
Without her fitting, after her fitting, she was very aggressive.
Wow.
Nobody could easily restrain her.
Wow.
Yes. Then the next 2 days we had another one. Fortunately, we were able to save
all of them.
Yes.
Were fine.
Yes.
Wow.
So we were able to calm her down. with medications and then the treatment. Then we were able to take the baby out by cesarean section. The second one came 24
hours later.
Yes. She also fitted at home and she was brought. Yes.
So currently these people are fine in their homes and doing well?
Oh, no, usually when it happens like we monitor them for a while. We want to be sure they are safe. Okay. So that brings to mind what puts us at risk of developing
this.
Yes.
Okay. Please tell us. So we can briefly help in the local language so that our listeners.
Hypertension in pregnancy. Doctor, I know Busugbo, a lefuno for Akpajide, like a mere Akakamana exonoase.
About me, maybe a milk pond like Ovo Amandine, a bantanya, but if you have a Busugbo, go a few full for Lemia Bogu, my milk pond, a Koshida bland. Am I right?
Yes.
artificial blood never. If you have a BP level, after a full for if you have now one year chronic hypertension in pregnancy. Alone, I'm a many of a BP level, you over antenatal. First time, we check over BP and like before you repeat before 20 weeks. As it cost blava man, any problem? Oh, Mama BP level, I feel full. Ye, Vavalia, in a camera, we are never pre-eclampsia. If you have a you full for the antenatal, you be piamology full. After cultural blava, magma, no papa doing here, you'll be PA, I feel doing here. I'm a new papa, you for, but you move at that time. Hello, you meet I know global a tired room, especially a tango battle, alone cook, allow you G. Amy, but me check you about to draw her. Because you get an over food up. When I know Okona to Robbie, Okon, none of them are sugar, protein, net protein, ye BP and let you for Mama, a poor pre-eclampsia. That is, I carry you full food after 20 weeks. Your papa BP before you, Mama, you say, the person has gestational hypertension.
I can never am over me when I'm looking when you did them. Gina Jamala Modum, Guafia,
Cashan never bo BP, Blagan, Margot, Blagan, Marco, Yanagana did them. No, even never Patagon, Blago, no, handy. My young Marca couldn't blow. Unless can BP like I love a meow cover. I did BP, maybe before. Too much no food, but people cover other funny. I can have my vagba, you check it, my allergy food, I come allergy food. You're not gonna do them. Your phone, no. I'm not going to position when you actually got check. The cost, about 90% of the cost is not. That is if you take hypertension in general, not even including the one in pregnancy. Yes, I mean, including the one in pregnancy. So hypertension in general, about 90% is unknown.
You don't know the cause?
No, so we call it essential hypertension. It's not that the cause is not right. It's not been identified. So it's essential hypertension.
Okay.
So for the remaining 10%, that is, we say it is secondary to either maybe the person having a renal problem.
Okay. Renal, when you say kidney problem. Okay.
The kidney problem, there are plenty, but broadly we say kidney problem. It can only be identified upon investigation.
Okay.
And then sometimes we say it could be due to an endocrine problem. When we say endocrine, there are some special organs that release special
hormones. Okay.
Hormones become another. They release special chemicals.
Okay.
If those chemicals are lacking or they are in excess, they also tend to give a lot of problem. Then the other reason is maybe hormonal growth hormone, and that's also part of the endocrine.
Okay.
Then of course, sometimes drug induced, you understand.
Okay.
But the key ones are then tend to be the renal. That is the 10%. Among the 10%, renal tend to be the most devastating one.
Wow.
It's the same thing with the
pregnancy.
Pregnant women. So that if the person's hypertension in pregnancy is due to a chronic hypertension, it could either be essential hypertension or a secondary cause. But if it is due to the pregnancy itself, then of course it means
when the pregnancy is done, then
yes. Okay. But the pre-eclampsia itself, they think theories, a lot of theories have said it's a problem of the placenta.
Oh,
yes. Okay. So we have a saying that the cure for pre-eclampsia is delivery of the placenta.
Oh, okay.
So it means once the placenta is
out,
pre-eclampsia is likely to be taken out.
Oh, okay.
Except when the complication had set in. Okay. Now it is difficult to control.
I see.
So the cause 90% essential, 90% tend to be essential. That is hypertension in general. But with pre-eclampsia, it means the placenta is also contributing. There's an issue with the placenta. They have a whole host of theories that tend to explain why maybe you are having preeclampsia.
Okay.
So if studies have shown it has to do with how the when the placenta is formed, how it invades the uterus.
Okay.
If it doesn't invade properly, then there's a problem. It builds some resistance regarding blood flow to the baby. And you see, because it didn't invade properly, the maternal system also recognizes the fetus as an alien.
Okay, so it's rejecting it.
Yes, it begins to produce some other. So there are so many theories to explain the preeclampsia. But the essential thing is that once there is hypertension, the measures have to be put in place. But of course, having all this in mind, there must be some risk factors. There are some risk factors that also puts
someone has a higher chance of getting the
preeclampsia or